Thank you so much for coming out this morning. Start off by introducing myself. My name is Henry Caligari. I will be the coordinator for this working group, and I'm thrilled to see so many people in this room who have continued to do such great work for survivors and victims of sexual violence, exploitation, and domestic violence. And I think this is really going to be a great opportunity, this working group, to A, establish where we are as a county, what we're doing well, what things we need to be doing better, and then from there talking about solutions as far as coordinating resources, but also as far as making sure that we are doing and establishing best practices in the county, and that we're expanding on what we do well and working on solutions for the areas that we could be doing a little bit better. So my role in this working group, I'm not chairing it. We don't have an official chair. I'm not running it or anything like that. My goal is to help facilitate and make sure this working group is able to fulfill its job, and that we're able to do the best that we can to achieve those goals. So I will be your primary point of contact. I think everyone here has my email address and my phone number. So I'll be the person sending over the agendas and working on scheduling and working with anybody in this room who needs any assistance with anything or wants more information. I'm happy to be the person who you go to on that front. Also, Kelly LaValle, who's my assistant, she'll be helping out. She's running the WebEx meeting, so which is quite a bit of work as we've experienced over the last couple of months. But we'll be, again, there is a WebEx option for folks who can't attend in person, and we're recording the meeting as well. So that way, if you aren't able to attend, you'll be able to get a copy of that as well upon request, and she'll be taking notes too. So those will be circulated after the meeting. It's an opportunity, again, to make sure that we understand all of your schedules are busy and many of you have other commitments. So if you can't attend, you will be in the loop. I want to start off by describing the impetus behind this working group. And last year, as the county executive has done since he took office, he has attended and set up with the council members budget town halls. And consistently, the county executive heard from members of the community the need to address and improve what the county is doing regarding sexual violence, exploitation, and domestic violence. And in his fiscal year 2024 budget message, the county executive pledged the creation of this working group to make recommendations to bolster the county's ongoing efforts to support survivors of sexual and domestic violence, as well as to improve prevention in the first place. And this working group combines county and state agencies, departments, and offices with our private partners, as well as advocates and legislators. So our goal here is to recommend solutions to better coordinate those resources that we have in place to meet the needs of survivors in the county, as well as to potentially recommend policy changes to address those underlying issues. And hopefully, at the end of this year, after a number of meetings, this group can produce list of recommendations to the county council, the county executive's office, and also potentially at the statewide level as well, depending on what this group determines are the areas of need. So for future meetings, we're going to bring in other folks, not just going to be the people in this room, because this is not an exhaustive roster, so to speak. There are other organizations that are involved in this process, whether it's the local colleges and universities, Baltimore County Public Schools, other groups that play a part in, addressing sexual assault and violence. But we want to make sure that this is a holistic organization. So one of the points of the agenda today is to discuss some ideas for potential future meetings and who we'd like to incorporate going forward. And in terms of scheduling, just to give an idea, right now we're looking at every 2 months, understanding that monthly it can be, in some cases, too difficult to attend for all the members. We want to make sure that we have as many people in the room as possible, but also that quarterly, every 3 or 4 months, that's not sufficient to get real solutions and to make sure that we're actually moving forward in a concrete way, and that we're not spending each meeting reviewing what we did last meeting to make sure everyone's up to speed. So before I turn it over to the members of this working group, I want to once again thank everybody for attending today. And for those who are attending virtually, I want to thank you as well. This is a unique opportunity to bring the major players together in providing services for survivors of sexual exploitation, violence, and domestic abuse to the table, so we can establish what we're doing and how to improve it. And I'm really thankful that everyone's taking the time out of their busy schedules to attend. And now I'm going to turn it over, and I'll start to my left here. And really the purpose of today's meeting is to establish who everybody is, who you're representing, what organization you're part of, what your organization is doing, to put it bluntly, what your involvement is, and what work you're doing, and then also what your personal goals or your organization's goals all are for this working group. And really feel free to go into some detail here, since this is the primary focus of today's meeting. We're not getting into the nuts and bolts of money or the details, so to speak. We're really just focused on establishing what your groups are doing. And so I'll start to my left here.
I'm Audrey Bergen. I'm the manager of the DOVE program, which is the domestic violence program at Northwest Hospital, which is a part of LifeBridge Health. The DOVE program also sits under the Center for Hope, which is a LifeBridge Health entity that addresses abuse and violence across the lifespan, so from children to elderly. The DOVE program in particular is, like I said, located at Northwest Hospital. We respond to the hospital 24/7 for patients who are identified as being victims of domestic violence. We also get all the police reports from the 4 precincts on the west side of Baltimore County, so Wilkins, Woodlawn, Pikesville, and Franklin. We participate in the LAP, which is the Lethality Assessment Project, which Family Crisis Center and Turnarounds also participates in. And Hannah, do you do some work?
We participate in the
City
with health program.
Perfect. So we have a 24/7 hotline that the police officers call from the scene of a domestic violence incident. And then we're also doing cold calls to victims who did not meet that threshold of high risk, but still are having domestic violence. So we get referred about 1,700 victims a year. We provide services to about 1,600 a year. So some folks we've been seeing for years. So we do have both traditional talk therapy with a social worker as well as an art therapist. And then because the needs for mental health so dramatically increased during the pandemic, we partnered with local agencies, provided them with some training, made sure that they did trauma-informed care, and will pay co-pays for folks who do that for therapy for up to a year. We provide hotel sheltering. During the pandemic, we worked with coordinated entry and did that. Now we do it primarily for hospital patients as well as police referrals who are considered at high risk for being killed. We have an attorney who does represents clients at final protective order hearings and helps with other associated hearings. And we also work with VSP, which is part of LifeBridge Health, the workforce training program where people do a 8-week paid internship at the hospital and then get help with resume writing and job applications and job search, and see them through getting a job and sustaining that.
Thanks. Then I guess the next step would be any goals that you or your organization have for the working group.
So I was looking ahead at the kind of aftermath of the pandemic, and we identified a number of issues, particularly around housing. And
Sure.
So we came up with a long list of issues that we see impacting victims even more now. I mean, housing's always been an issue, but we see additional barriers with that. So I do have a long list of ideas.
Great, we can get into that once we're.
Yeah.
Thanks.
Yeah.
So my name is Roz Berkowitz. I am Vice Chair of the Baltimore County Commission for Women. I retired from GBMC, I guess it's 2 years ago now, a year and a half, 2 years, as a safe nurse. And I also am co-chair of the Maryland, my mind is blanking. Haven't had enough coffee. Of the Fatality Review State Implementation Team, looking at ways to reduce the domestic violence homicides in Maryland. So I know Shelby is on that as well, and Shelby and her group were looking at family justice centers. So I'd like her to speak to what they found, if you can. And then the other thing is, I'm sorry, but I'm the one that started this mess, because I think this is really important. It's been proven through research and across the country that family justice centers are best practices for victims of especially domestic violence and sexual assault. I don't know if they go into APS there. Some of them do, some of them do not. But victims feel more supported. They're more likely to follow through with the prosecution of the case. They're more willing to cooperate, for lack of a better word, because of the support they get. And it's also one-stop shopping. They can come to one place and get everything they need, which also is supportive to victims.
Hi, I'm Rebecca Allen with the Governor's Office of Crime Prevention, Youth and Victim Services, formerly the Governor's Office of Crime Control and Prevention, GOCAP. I think majority of you guys know who our office is, but we are a very large grant funding office providing all state and federal funding for victim services, criminal justice, and youth services come through our office, about $300 million annually. And then we also have policy areas, and I'm focused on victim services. I work with the Governor's Family Violence Council, who is focused on domestic violence. They are also the certifying body for abuse intervention programs, which are the court-ordered programs for domestic violence offenders in Maryland. I also work with the State Board of Victim Services on victims' rights. This involves, victims' rights from the beginning when a victim comes into contact with law enforcement to the state's attorney's office. We also work with the state's attorney's offices to help with relocation. There's $300,000 at minimum that comes through our office to go to state's attorney's offices. And they're the ones that use this funding to help victims with relocation. A lot of it does go to domestic violence and sexual assault survivors, but it also is focused on primarily homicide as well. I had something else I was going to say. But our office, as you know, it is focused on policy and legislation. So we support, individual counties as well as statewide agencies to implement policy changes. And so I think this is a great group for us.
Good morning, all. I'm Scott Schellenberger, State's Attorney for Baltimore County. So I sit on the statewide sexual assault evidence kit commission or committee. We've been meeting for a couple of years now. Also in my office, I have 5 assistant state's attorneys who only work on sexual assault and child abuse. They're dedicated to that. We used to only have 4, but Johnny O last year put in our budget money to give us an extra prosecutor, and that prosecutor was promoted and put in the sexual assault unit. So there are 5 assistants in there, plus a law clerk, a paralegal, and 2 paralegals who work on these cases. In addition, we have a dedicated domestic violence unit in which we have 4 prosecutors. When I say prosecutors, they handle the serious felonies. Everybody handles the more the cases that come in district court, but these folks specialize in the domestic violence cases and the sexual assault cases that are handled in circuit court that are felonies. So in our domestic violence unit, we have 4 attorneys who are dedicated to those, along with 4 paralegals who are the main contact with the victims of domestic violence, and also a law clerk who works for the attorneys, getting cases ready and doing research. Obviously, we're a pretty busy office. We handle about 45,000 cases a year. So we are very busy and handle a lot of cases, but we try very hard to specialize and give a lot of specialized attention in the area of domestic violence and sexual assault. And I go to Annapolis a lot. Right, Shelley? Shelley gets tired of seeing me.
Hi, good morning. I'm Carmen Christiana, and I work with the Office of Community Engagement. Director Mandy Remmel is on the work group, but she had asked that I also assist with this group. She unfortunately was unable to attend today. She had a conflict in her schedule. In my role, I also serve as the liaison to the Baltimore County Commission for Women, as well as the Human Trafficking Work Group. So I'm very, very well vested in this group and really want to dive in and see how we can assist in our roles.
I'm Ashley Meyer. I run the Division of Grants Management in the county's Office of Budget and Finance. We're the clearinghouse for the grant activity in the county, and we kind of oversee some of that. So my role here today is mostly to be support staff and to, as we start talking about solutions and ideas and initiatives that we want to pursue, to see if there's an avenue to leverage, existing external funding to support any county endeavors, see what we can do in terms of collaborating with different agencies and departments in the county from that perspective.
Good morning, Juliana Valencia Banks. I'm the Chief of Immigrant Affairs for Baltimore County. In my role, I'm responsible for overseeing strategic initiatives to better serve our immigrant community, including economic development, community well-being, and access initiatives.
Morning, everyone. I'm Councilman Pat Young, representing District 1, southwest side of Baltimore County. I am excited to be part of the group and was humbled to be asked to participate. Well, from a logistical standpoint, I imagine when we start talking about legislative changes that need to happen at the county level, I can play an active role in and provide opinions on what we can do and how we can be most successful at moving those forward. One is the fact that this is a diverse and dynamic group of, just going through the list before coming in on who's participating, who's here. You are going to be the best advocates for making that change. I will just do the best that I can to then make those arguments to my colleagues, which I don't think will be a very hard sell, depending on what some of the outcomes will be from this group. Also, just want to point out that as a former member of the Maryland House of Delegates, it's nice to have a closing of a loop, because I know working with Senator Hellman and the work that she did before I got here, and also our new colleagues, Delegate Jennifer White Holland, looking forward to then seeing what I can do to be supportive of the work that being done in Annapolis still while I'm at a local level. So with that, happy to be here and look forward to supporting the work that we do.
Good morning, everybody. I'm Janine Scott. I'm an attorney at Maryland Legal Aid. I'm the chief attorney of its Baltimore County office. Maryland Legal Aid, we're a statewide not-for-profit law firm that provides free legal representation to low-income and no-income Marylanders. We do provide legal representation in domestic violence cases. I've been handling domestic violence cases for over 20 years. In addition to that, I do family law cases, so I also provide legal representation in divorce cases, which also usually does have a domestic violence component, as well as very hotly contested custody cases. We do have attorneys who, for lack of a better word, specialize in providing legal assistance in domestic violence cases throughout the state of Maryland. My goal in terms of participating in this committee or work group is to, first of all, let everybody know that we are available. We do have income guidelines and limits, but also to find ways to collaborate and partner with everyone to make sure we serve impacted individuals holistically. Also, one of the things that I'm hoping to see as part of our advocacy is to focus on those, teenagers who also are a victim of, stalking, intimate partner violence. I think oftentimes that group gets overlooked. So I'm just hoping that we'll be able to serve young Baltimore County residents in that way.
Hi, everybody. I'm Sheldon Frank. I'm the Executive Director of Family Crisis Center of Baltimore County. I'm a comprehensive domestic violence agency. We operate the emergency safe shelter for Baltimore County. The helpline, as mentioned by Audrey as well. We also operate our abuse intervention program, which is a 26-week program. We also have our victim advocacy services, counseling services that we operate, and then a children's program as well. Roz mentioned that I am a part of Maryland. I'm just going to pronounce the diversits is what we call it, but I am one of the chairs for the community services subcommittee, and we have talked about family justice centers. And I took on that role last session, is what we call it. We did not do as much as we wanted to with it, but we did learn about what was taking place in Montgomery County as well as PG County and how they operate, and looking to do more in that realm of understanding what a family justice center could possibly do in different regions. I'm also a part of MAKE, which is the Maryland Abuse Intervention Collaborative, where we come together and try to discuss on best practices and ways to be better in our abuse intervention services. A goal for myself and this work group is understanding the preventative measures that we can take, more preventative measures that we can take to come closer to interrupting these cycles of violence.
Morning, my name is Krista Trahan. I'm the co-director of the Child Advocacy Center in Baltimore County. For those of you who don't know, Child Advocacy Center is a place where kids can come and be provided one center where they're not having multiple interviews during an investigation. So we're co-located with Crimes Against Children Unit, police, forensic interviewers, social workers, victim advocates, mental health. We partner with the state's attorney's office. They're not co-located there, but we do partner with them. We're there weekly. We have medical services, and it's supposedly a one-stop shop, but I really am looking to see how we can improve services, partnering with all of you at the table if we can to make things better. I am on the CJAC committee through SOCAP. It's pretty new term. I'm also the chair of the CAC leadership team at Baltimore County, and I'm on the board of the Maryland Children's Alliance. We are fully accredited CAC. We've been accredited since 2009, particularly looking to partner and explore, as I told Henry, with how we can improve with the police department and maybe expanding services. My long-term goal is to have one big CAC where we can all be co-located. That's my grand plan, but let's see how that goes. But I know that victim advocacy is a big part of what we all do, and we need more of it. We also partner with Turnaround. They're our regional navigator for Baltimore County. I'll stop there.
So my name is Amanda Rodriguez. I am the Executive Director of Turnaround. We are the designated rape crisis center for Baltimore County and Baltimore City. We are a comprehensive domestic violence provider here in the county. We also serve intimate partner violence survivors in the city. And then we were the first human trafficking service provider in the state. We started in 2011 providing those services, actually when I was a prosecutor, and I would refer to Turnaround. And we serve human trafficking survivors in Baltimore County, Baltimore City, and Howard County. We are in the process of building the first home dedicated for child sex trafficking survivors that'll be available statewide. That's actually located in Anne Arundel County. We are a comprehensive provider similar to the work that they do at FCC and at DOVE program, although DOVE is not quite comprehensive yet. So we have AIP services, we do emergency sheltering, we have a 24/7 hotline.
We have counseling services, advocacy services. And so it's, again, we've been in the county since 1979 and kind of provide all the same services as described by my counterparts. We are part of the coordinated entry program with Family Crisis Center, which they lead. We are the regional navigator, as Krista mentioned, which means that we are basically the spoke in the wheel for child sex trafficking survivors in the county. I am the chair of the working group on human trafficking here in the county. I'm the chair of the legislative committee of the board of the Maryland Network Against Domestic Violence and the chair of the legislative committee of the human trafficking subcommittee of the Maryland Human Trafficking Task Force.
My name is Amy Blank, and I'm a commissioner on the Baltimore County Commission for Women. Previously, I was a lobbyist for children and families at Advocates for Children and Youth, and prior at Planned Parenthood. So I've spent a lifetime of advocating for women, children, and families in Maryland and abroad. On the Commission for Women, we identify, do research, and bring together partners to address issues that are profound in our county, one of which is human trafficking. So a couple of years ago, we helped pass legislation on identifying and reporting cases in hotels and motels, and have since moved on to transportation hubs. So we try to look at the issues most impacting women in our county and try to address them, one of which has been intimate partner violence, child abuse, sexual assault, human trafficking. And so that's where the impetus of the idea of looking at ways to bring us all together and to better coordinate services on behalf of those for whom we all serve.
Great. Senator Heddleman.
I'm Shelby Heddleman. I'm a senator from Baltimore County, District 11. I have been the sponsor of and passed a number of pieces of legislation having to do with domestic violence, having to do with sexual assault. I serve with State's Attorney Schellenberger on the Sexual Assault Evidence Kit Policy and Funding Committee out of the AG's office. I've been doing that for many years. I'm also on the TV committee, brutality review. And I actually, this is not this yet, but I sponsored legislation last year to create significant reform to the criminal injuries compensation board, and that is going to be part of the governor's package. This bill.
I was the first director and helped put together a condo, which is a program.
Hello, everyone. I'm Amy Bollinger-Smith, and I'm with City County Services. So within the community-based services, and
Like it did the other.
and so they do a variety of things. We have four advocates of us to be all over the coast, so we provided them some staff to do that. We have case monitors, so here in Baltimore County.
I wonder if your screen black.
Well, that's what I'm saying. Screen. Where are case monitors to help those that have been able to not only get them connected, but also monitor them and then report to the court that's going, right? We also have a grant that supports internal DSS work with our child welfare system and with our FIA system. So we have social workers that are DD experts that are co-located with child welfare. So that if there are cases that they're working with that have a domestic violence component, rather than only focusing on the child safety and possibly removing the child and bringing them into foster care, we can leave the child in and provide DV services in the entire family and the child can come. We are the only jurisdiction that is doing that on the court, except for incredible. Within that grant also, we have co-located a DV specialist within our FIA services. So they work our DV victims that are in job network. Often they are not able to complete the job network and become into self-sufficiency because so they have now our case manager. We also have a therapist through that grant that works with our CPS and our police force when they're in homicides, so that that therapist shows up on the scene, work with that family then after the homicide to make sure that the children and any family member get the mental health that they need. It's allowed to get into long-term therapy situations, so stay with that family health capacity until we can. So that's that grant. In addition to that, we try very hard to work with our service providers to make sure that there's coordination for the county. We have providers that are geographically local. We want to make sure that all students, no matter where they live, work or play in Baltimore County, the same access to services. So we chair our DVCC. We try to bring the service providers together, make sure that we're all. We try to fill some of the gaps around outreach materials. So we are the ones who do the cards and try to keep them going and in the hands of all of you and all of the folks that you're working with. We make sure that they are done in a way that fit in our police. So everything is very strategic about those get help cards and outreach materials. We are one of the major sponsors with DPCC members for the DD conference, which we hope to have another one in person. We are the ones who provide the pass-through for the marriage license fee grant money that comes into the county and that OBF and then comes through us, get onto the street service providers. We're also involved with LAC, we're the contact people from the state for our child. We also participate on Fidelity Review Board. We represent the DCC at the Criminal Justice Coordinating meeting. We provide training for court staff, for commissioners, for police, and on, right, as most of us. So one of the things that, one of the goals that I would like to see is a better and more collection system so that we know in our county some of the data points that individually in our agencies, I think very well, but in terms of our county, we're all trying to run grants, we're all calling each other. So I'd like to see a better dashboard for that.
My name is Alicia McGough. I'm the Deputy Director of HANA. HANA was a program of the Associated Jewish Baltimore. We provided Jewish response to survivors and the loved ones of domestic violence, sexual elder abuse. We serve Baltimore County. And our services, like many of my counterparts, we provide supportive counseling, support groups, advocacy. Well, we are socially responsive and trauma informed. That means that we are going to and incorporate into every one of the services. Great example of that is if we are sheltering someone, we're going to ask them if they need to be sheltered in a place. We the grocery store or goes to a school where their child attends. Well, do they observe the Sabbath and do they eat on a floor that's lower because they're not going to use the stairs up and down 12th floor? It's not. So that's just like one small example of service providers. And like I said, we survivors. That we are, I see many familiar in violence based body review team. That all of those meetings. Founder of a forum response meeting, response within where we were training law enforcement, APS, not CPS, but healthcare professionals, allied professionals, mortgage brokers, bankers, hairdressers. We will talk to anybody to come. We also have a fifth old to 105 years old. So our prevention has in program safe touch and reporting and safe reporting. And we have programming for the rest of elementary school, middle, high school, and as well as working with Fire Hillels for college. Lots of general education, lots and lots of education, abuse in our senior centers, in our senior, in for the Department of Aging. Happy to come. And within the city, our partners with the House of Ruth program, with our partners here as well as with law enforcement. I just had one officer. That is a common occurrence, I think, for a lot of us. And our goals for this meeting are really to collaborate both since the pandemic. Whereas, and I hope my colleagues will correct me if I'm wrong, but I think with remote a lot more geographically specific. I'm present typically in any little county with access services work over there. All providing service to a lot more people. And that being said, I can tell you that in our 25%. So the calls are coming in, not only coming in volume, but all domestic violence is here. All domestic violence. But there are cases that are substantially complicated, others that require the needs and the barriers. Barriers where a driver who maybe is a person and has limited English and is this is like boiling down to like the first. That's not uncommon for any. So as those cases are complicated, it's a greater expenditure of resources. And with that, I think that all of our community are making demands higher and resources for less. So I really look into how we can collaborate, how we can expand.
Brian Edwards, captain with the police department.
But you're basically to support and assist people. My career investigations, 5 years of which was in homicide, and so it's definitely seeing it always fell hard on me that a really significant number of our cases that we see in Baltimore County, especially prior to changes over the for domestic related, oftentimes made a situation. More recently, was the commander of the Special Victims Unit, the County Executive First Team. One of the first work together was the Sexual Assault Task Force in this very room, and this was kind of an opening of my eyes to the multi-pronged services that are available. I think for me, a real eye-opening thing that I would share with this group, I think the same thing would probably likely occur. It is a lot of us in the room had very great intentions, had very heartfelt dedication, messages. But each one of us didn't know what we didn't know. Each one of us was so busy and so dedicated to what we were doing. Really hard to lift our heads up and take. And I think this group has an opportunity to do that in this. During the time at SVU, also when the pandemic hit, and I represented the police department. And many of you, I know many of your names, and this is the first time seeing you in person because everything. Trying to bring all of these services together and get access into people's homes when they weren't able to get to us quite freely. I didn't know many of the services that regional approach was necessary geographically, but it inherently created this mean spirit, not a role, but competition amongst service providers. Some sort of service providers that were really strong at certain aspects. During that effort, everybody kind of dropped those barriers. Synergies really surface. And that's where I think I got to see the strength of all the things that existed. I think that's what we learned. Attorney Schellenberger and Senator Hellman sit on that same committee. Attorney General's Office of Sexual Assault is working to change the laws, improve the laws for victims and survivors, bringing a statewide safe kit inventory tracking system to Maryland. Really looking forward to seeing ways in which maybe some legislation can come out of this group, how support that. Ways in which the police department's data can be brought out to support questions that are asked here. You mentioned in the data, we have tons of data and don't always harness that well with our partners. So looking forward to being able to do that. Also, the nonprofit engagement work that I thought was a really innovative way to bring county resources that could be shared amongst all the different service providers, would make it a positive effect. Providers, what we're doing.
Still technically. So, good morning to everyone. First of all, I'm Chief Robert McCullough, Chief of the Police Department. Proud to say that our agency, many years has been working closely with many of our partners here. Other than that, I'd like to say that my 38 years of law enforcement sees drastic how we handle and respond to violence, all family related throughout my career. Say that when I first came in. Of course, we're the police department's the first line to respond to much of the violence course, in the police department, we have our domestic violence. Domestic violence coordinators, of course, deal with the victims and also deal with people and set up plan along with the children. And one thing we don't talk about is the spillover for kids to the children, but not only the spillover into the schools too. So something that in terms of cycle of violence. Of course, in the police department, we have our criminal investigation bureau where we have our special victims unit with sexual assault. Of course, we deal with trafficking, our children, child-related sex offenses. Of course, you talked about, domestic-related homicide here. I'm a past board member of Family and Children's Services. I also supervise the violence court. So I clearly understand violence. In terms of our goals, I think we can always improve. I like this program and what we can always improve. So one of the things I'm looking for here is looking at how we currently do things, but looking at ways to enhance our responses. And I think a lot of improvements responses, and even now when we sit down and have our meetings, analyze specific incident, we're still coming up with decades later changes that we make because things change. Circumstances are. I'm really interested in looking at our response and enhancing that response. Just things like process improvement, working both local and state level with legislation, and of course, lastly, what we talked about was the whole issue of how we collect the data. Already made some notes self for go back and have some meetings with my personnel and talk about how we're collecting data, domestic violence, and once again, we say domestic violence, we always know it manifests itself, and we may even need at some point to even look at definition. How would be defined?
Chief, I'll just add in that I think the model of having the domestic violence coordinators in each precinct is excellent. I've thought that for years. It makes it so much easier to work with a victim to help keep them safe. If there was an issue, we know exactly who to call. If we need, something to happen in terms of the victim's safety, we know who to call. I just, when someone comes into the hospital and you ask like, where are you from? Baltimore County, or no offense to those in the city, Baltimore City. It's like, oh, good, Baltimore County. Okay, so that's going to be Officer Schulter. That's going to be Officer Kelly. I think that model just works really well.
But even looking at that model, because I worked with all of them personally myself. Once again, when I talk about process improvement, I truly believe that even with that model could even improve. Ross and I worked together for years, so.
I just want to echo that, and that who's going to speak in a second, else Ruth can validate this. I've recommended this in our Baltimore City very frequently because it is so nice to have that point of contact. And for us non-law enforcement people to have that sort of contact who you can have a relationship with and say, I'm seeing this on a police report. It doesn't make sense to me. Am I right that it doesn't make sense, or can you explain this to me? And it helps us to explain things to our clients so much better. So I just want to give credit where credit is due.
And another part of that whole DVC part is the fact that our DVCs are incorporated into our community outreach units. So it's just an extra layer of our community policing in terms of we have the DVCs, But we also have community outreach, and many people don't know, is those community outreach people work hand in hand with them, going out to, to the clients' homes, homes, backing those people up when they're off.
Yep.
We only have one per precinct, but essentially we have more than that because those community outreach officers, in addition to everything else they do, they also do DVC work also.
Yep. And I just want to reiterate what Audrey said, because I also testify in some other counties. And when I tell them about the DVCs here, they're very jealous. They don't have that and they wish they did. So.
It is, I tell you, it's been extraordinary,
Yeah.
just having them. Like everything, change is difficult, but we saw it immediately when we went to having those DVCs, we saw a drastic impact on domestic violence, because in the beginning of my career, honestly, we responded to calls for service, and we saw family members, wives mostly being beat up. I worked on one, so Express Point, GM, all those Western Electric, the employees that worked there. It was some really harsh things that I saw as a 21-year-old going into perspective. And I would say that we evolved from that. I wish we had, that we completely eliminated domestic violence. But what I can say is that there's been drastic improvements and harshness and the level of violence that once existed. I'd like to believe it doesn't exist any longer.
Can I share? I think this is a little bit of a microcosm of the whole big picture that we're talking about. Baltimore County, at one point I was told, it's the third largest jurisdiction in the country with no incorporated. Our police department's the 22nd largest in the country. Every precinct in Baltimore County is larger than the average police department in Baltimore County. And I say that from the police perspective, but I think it speaks to the geography of Baltimore County. The regional approach is what we're talking about with the DVCs, and it works really well. The regional approach itself also creates barriers. So the process of improvement, the training, the providing a consistent product all across the county is different. As you mentioned Mark Schulter, right? You mentioned Darren Kelly.
Oh, yeah.
So you're talking to the best of the best. Yeah. And that's not to say that we always have that in that position. And so I think the same thing holds true. The regional approach that a lot of our partners have creates a real strong access to regional specific services to our populace. But it also creates a little bit of silo. And so as much as it creates strengths, I think it also can actually create the weaknesses. So I just think that that's almost me, a bird's eye view of this group is trying to figure out how to make the regionalism work really well at the same time as the localism supported.
Hi, I'm Sam O'Neill. I'm the County Executive Senior Advisor and an unofficial member of this group. I'm not on the roster. I'm a guest today, and I'll probably attend as many meetings as I can because County Executive asked Henry and the team with really putting this effort together. So I just want to thank you. I know we've got several other folks who are really kind of in the soup and doing the work. So I want to respect their time and expertise. But just thank you. I think we're going to hear a lot from providers, from our partners in law enforcement. Certainly on the legislative side, we've got really terrific partners in Annapolis and here at the council level, trying to advance really important policy items that we all care about. So thank you for your time, talent, and expertise.
Good morning. My name is Lisa Nitch. I am the Chief Operating Officer at House of Ruth, Maryland. Some of you have watched me literally grow up there for the past 25 years. Nice to see some faces. I'm going to apologize for being late. I'm still relearning commute times now that we're transitioning back to being in person. House of Ruth, Maryland is a comprehensive provider. We serve Baltimore City, Montgomery County, Prince George's County, and we're, in Baltimore County, we serve about 20% of the 8,000 people we serve every year are Baltimore County residents. Many of our partners here, we have, the comprehensive services for survivors as well as children. I think what sets us a little bit unique is we also provide free wraparound services for the abusive partner that target lethality indicators. which is kind of some of the goals that I have here. When we talk about this group, obviously this is a resource-rich community. Baltimore County is really lucky to have so many providers, but coordinating them, reducing the overlap and filling the gaps, I think is really important, particularly around the need for safe, affordable housing. And we can get people into shelter. We can't seem to get them out, which creates a lot of tension between providers, particularly those of us who are holding shelters, because we're told we don't let anybody in. It's not that we can't get anybody in, we can't get anybody out because they need safe, affordable places where they can be long-term. So rapid rehousing models and things like that would be, focus on that would be great. I love the idea, that Roz and Shelby were talking about with family justice centers. I also think we need to be looking at parallel processes for families that don't feel safe participating in the criminal legal system and how they can.
A lot of that overflow at our city locations. So would love to see a focus on that. And then my passion, I just emailed Jeff. But I currently, I sit on the Family Violence Council, and I'm on the advisory board for the National Center on Domestic Violence and the National Family Intervention Network. My focus and expertise is really around working with offenders. And I would really love to see, much like I want to end this. And I think we all know we're not going to shelter our way out of this. Hiding victims isn't going to do it. Without reducing resources for survivors, I really get to have risk assessment tools and
in a way that makes sense. And we have lots of research that talks about what makes somebody more dangerous. And we have a lot of opportunity there. Thank you.
Before we jump to the people on the phone, I just want to say there are a few initiatives that I failed to mention that a few of you touched on that you work with our office on. So the Regional Navigator Program, it's a human trafficking initiative with youth survivors to connect them to services. And we are currently in 23 out of the 24 jurisdictions. I think we have one more left, and we're hoping to get them on board by the new year. And then we also house the Criminal Injuries Compensation Board program, and also the Sexual Assault Kit Initiative tracking system. That's going to be through our office. And then the Handle with Care program was kind of touched on a little bit between law enforcement, mental health, and schools. And then the hoteling, our office certifies the training that the hotels used for human trafficking. And then the Domestic Violence Central Repository, that is a system through the judiciary to access peace and protective orders, and our office certifies those. So just a few more things.
And I'll just throw out, I'm the chair of the Baltimore County Domestic Violence Fatality Review Team. Still.
All right, so now we're going to turn it over to the folks on WebEx, and we'll start. I'm just going to go in the order that they're displayed. We have Delegate Jennifer White Holland.
Yes, good afternoon, everyone. Delegate Jennifer White Holland. I represent Maryland Legislative District 10 and have the pleasure of serving on the Health and Government Operations Committee. I am truly honored to serve on this work group and to work with all of you, and disappointed that I wasn't able to make it with you there in person. But overall, I think Councilman Young articulated this along with my other colleagues, is that truly, this is about collaboration and identifying opportunities that can help inform our state level work, and identifying and removing barriers when it comes to accessing the necessary services and supports that exist, but in addressing the larger root causes of this. And so looking forward to, if anything, learning more and how and learning more how we can better connect our constituents to some of the services that are available, and making sure that we're identifying other opportunities for us to collaborate and coordinate. So again, looking forward to being a part of this group, and hope to see you all soon in person. Thank you.
Thank you, Delegate. Now turning to Lori Root.
Hi, good morning. I am also sorry that I could not attend in person. I plan to in the future. I'm Lori Ruth. I'm the Chief Programs Officer and Legal Director at the Women's Law Center of Maryland. Our administrative office is in Towson, and we have a protective order project that travels to all 4 courthouses in Baltimore County to represent people in protective orders. Sometimes peace orders, although with the law changes, not as often. I'm also on the DBFRT with Audrey as our illustrious chair, and I'm on the Governor's Family Violence Council with Lisa Nitch and others. The Women's Law Center is a 50-year-old organization that has been working on these issues. I'm delighted that the county administration is forming this work group, and I'll stop there for now. Thank you.
Right, and Melissa Cross.
Hi, I'm Melissa Cross. I'm a forensic nurse examiner at GBMC in the Safe and DV program there. And Laura Clary was on the call. She wanted me to apologize. She had to leave for an emergency mandatory leadership meeting. So what we do at GBMC in the Safe and DV program, we are a group of 25 nurses and 11 advocates. We provide forensic services and advocacy services to our patients all for free. For the advocacy part of it, the advocates come in with all of the nurses for every case, and they provide any resources that the patient would need, legal, emergency, shelter. We provide transportation for them, gift cards for food or anything else that they may need. Our advocacy group also, and the nurses as well, we also host a support group for the youth survivors of abuse. We do that once a month. It's art therapy. It's been very, very successful. And that's something that we would like to continue to grow. All of our advocates are on call 24/7, as all of our nurses are as well. We also have an outreach coordinator in our program, and she schedules and arranges all of our outreach services. We do all the trainings for the Maryland Center for School Safety. We go into the Baltimore County schools talking about teen violence and other things. We speak at national conferences all the time and attend them as well. In addition to the nursing services and the advocacy services that we provide, we also have 2 anti-human trafficking liaisons on staff that are working very hard to just get out in the community and educate, specifically in the urgent care centers, so that the staff there can be more aware of things to look for. When it comes to victims of human trafficking, we also now newly have a part-time education person within our program that just helps kind of keep us all on top of everything that's new and what's upcoming, and teaching us all the right ways to do things, and monitoring and doing peer evaluations and things. We also have one staff member dedicated to the non-fatal strangulation as well. We also have a 24/7 child protection team that works really closely with the Child Advocacy Center, and they're on call 24/7 as well, because we do see children of sexual abuse, child abuse. We see non-fatal strangulation, human trafficking, and sexual assault patients. So our team sort of comes together, and we do everything that we can for our patients, and we're really happy to be a part of this group, so we can share some of the resources we have and collaborate with other people, so we can provide more resources for our patients.
Great, thank you. And I just want to also note that Sabrina Jones, who's the head of the Baltimore County Commission for Women, was also on the call and had to drop off early, but wanted to recognize her and her work as well. So again, the next topic, and acknowledge this is the first meeting and we're not really getting into the nuts and bolts yet, but one thing that, in talking with many of you in the lead up to this process, that came up was the impact that COVID-19 had on the provision of the services that you provide, and not just in the narrow framework of when the pandemic was raging, but in the aftermath, and how it's changed how services are provided, the expectations of survivors, and also the changes in funding with the additional supports that have come in from the government, and then also other subsequent changes to that as well. So I wanted to, and I'm going to open it up to all the folks here on our WebEx. If anyone wants to get into and discuss how your organization has been impacted, and looking ahead, how that may change or how that may stay the same in some cases. And I'll be the one calling on folks just to keep it organized, but I do want to open it up to the group here.
We work with all the comprehensive domestic violence and sexual assault providers, and kind of what Alicia said, I don't think the numbers have gone down in terms of the need. We're seeing it from all of the programs. We're hearing it from all of the programs. They all want more funding. So, I mean, in terms of thinking the crimes have gone down. I mean, I think it might be the opposite. I think people are still reaching out and it's even higher. I mean, programs, you guys can elaborate on that, but in terms of a statewide level, that's what we're hearing.
I can speak to that a little bit. So we saw a 300% increase in numbers during the pandemic, and we keep waiting for the numbers to go back to whatever and I hate using this terminology, but new normal is going to be. But I think that we're probably there for now based on the amount of outreach and awareness building that we've done as an organization. So I think as we continue to increase that, which is the goal for us, we're going to see those numbers continue to increase. Also, level of violence has increased significantly. So we're seeing much higher levels of fatality. I will be honest, I started 3 months before the pandemic hit. So our data was not necessarily the most perfect data in the world, but when we run our lab data, for an example, we're 4,000% higher than pre-pandemic numbers. One thing that we are, and Lisa touched on this a little bit, the biggest issue that we've been having post-pandemic is getting people moved out of shelter into a long-term placement. Shelter continues to be a significant need for us. Our trafficking numbers, though, have dropped dramatically in both the city and the county. And I think that there are a number of reasons for that. Regional navigator numbers, our kid numbers have gone up, but our adult numbers are really, really low comparatively. And so we're hoping to sort of strategically think about how we can continue to reach out to where we know folks are. In the city, we started to do street outreach, which has started to increase that number for us. And I think that in the county, we've not started that process yet, but there are clearly places where it's just over the line. In the city is where we are, and we know the numbers are high. So we anticipate the numbers are going to be high in the county as well. We just aren't doing any concerted effort because we don't have funding specific to that. On the funding question, I think that we were the beneficiary of ARPA money in the city. There were clearly some things written into the budget last year on domestic violence and sexual violence that we were able to get. And we anticipate that those dollars are going away because of what's happening with the budget and also what's happening with ARPA. It's just naturally going to go. We had a much harder time getting funding in the county through ARPA, which, I think that that's worthy of conversation at some point because it was just a very different conversation, very different. It felt different, although honestly, the process has been much easier in the county now that we have those funds. But we are nervous if the numbers are not decreasing. And in fact, we anticipate they're going to increase this coming year. And the dollars are going away next fiscal year. What is the county response to that going to be? And I had one point that I think has just clearly flown out of my head. Yeah, so funding is an issue. And yeah, I'm interested to see what we come up with.
So I left GBMC, but while I was there, I was responsible for all of the DV and strangulation stats and chart audits and everything. And I will tell you that in the very beginning of COVID, the numbers were non-existent because people were afraid to come into an ER and risk getting exposed to COVID. So the numbers were really down. Laura worked with them to change the process, and they would bring them direct to our suite. The numbers started to climb, and I can tell you that our DV strangulations increased about 35%. And I don't know last year's numbers, but up until last year, we maintained those numbers. They didn't go down.
Also from GDMC, remember talking to Lauren. So the ER saw a drop in the number of reporting and walk-in victims and survivors of domestic assault, but the OB department saw a drastic increase, and that was the one place where the use of partner was America separated because traditionally the dad was not allowed in. And so reporting occurred there that it didn't normally just difference in the ER. The abuse of partner, and once that did come to the ER, I agree with abuse that we just couldn't stay in.
And much more severe injuries too.
We also saw, one of the questions on the lap is, does your partner, can they easily access a weapon? And we saw that increase by 133% during the pandemic. I haven't looked at it again since. And the other point I want to make is around housing. I don't know if you all have noticed, we feel like there are many more survivors who are unable to get into housing because they, left a place, they were evicted. And so it just dawned on me the other day how much of that has to do with the rent moratorium that occurred, and then they needed to pay. There was also landlords couldn't raise their rent, and so now that they can, it's up hundreds of dollars a month. And so even if we have funding to be able to help somebody with security deposit first month's rent, we have a lot of people who have not been able to find anything that they're eligible to go into, as well as fewer, there was more kind of housing programs, rapid rehousing funding, and things during the pandemic.
So to echo up on what Audrey was saying, I think we're definitely seeing that. I think what Lisa's saying too, that it is getting people, well, it is getting people into shelter, but it is getting people out of shelter too, which is causing the issues for getting people in. But with that, so being part of the associated, I'm very fortunate to have collaboratives like this, but I'm also very fortunate to have the collaboratives within the associated system as well. And when I'm talking to my colleagues at like Jewish Community Services or HI, which is Community Housing Assistance Inc. They are saying that they are like they're not in the DP space, they are in the housing space, and they are saying they are seeing the same things. They are seeing landlords to recoup some of the funds from the eviction moratoriums. They are seeing 2-3 months rent, which if you're thinking about you're thinking about like, if you have a $1,200 rent, that's now $3,600 accrued in deposit plus another $1,200 for a first month rent. We're not talking about moving.
Yeah.
So that means that somebody who has just been abused for however long needs to be sitting on $5,000 to $6,000 just to get out of their situation and to see.
And that's probably a 1 bedroom. If they have kids, they need to.
So I 100% go that as well, and it is affordable housing that they can get access to is a huge issue. What we're seeing, I already told you about our numbers. So in the elder abuse space also, during the pandemic, we were seeing a decline. But just because we weren't getting calls doesn't mean it wasn't happening. We were hearing and thinking that older adults who, were so vulnerable to COVID were much more reliant on their abusers and their family members, the doctors, the bank tellers, the hairdressers, the people that the community members that they had regular relationships with weren't seeing and weren't having access to them. So those referral sources were going down as well. We're slowly starting to see those numbers come back up now. But I think anytime we have word about another variant or something like that, we're always at risk of this going down. And being part of such a vulnerable population, they became so much more reliant on their abusers. So we're grateful that they're coming forward because we want them to get help, but that is slowly starting to rise now. The cases that we are getting in both intimate partner violence and in elder abuse, like Becky said, like Audrey said, like Amanda said, I'm sure Lisa would have said it, but it is, Lisa and I are reading together, she would have said it. Are just, like I said, substantially more dangerous, substantially more lethal, and substantially more
And I would add that's not just on the survivor side, that's also on the perpetrator side, where we've got severely addicted, severely mentally ill, homeless people who are abusing their partners as well. And what we know from research with these offenders is that that sense of desperation, that lack of hope really does contribute to their lethality. And so it's really kind of it's coming at us from both directions. For those of us who have rapid rehousing programs, to Alicia's point, yeah, I mean, we're given a stipend. You cap out at a certain point, and you get that first, second, third month's rent and a security deposit, and they're capped already, and there's no opportunity to do the step down financial assistance that it was all designed to do. And HUD and the federal HUD program and the Office on Violence Against Women just can't seem to get it together in terms of data on what needs to be confidential and what needs to be public, and so it's really kind of creating a lot of systemic nightmares. So we're going to need local and state action, if that's going to be successful, because it's going to take a while for the federal systems to catch up, I'm afraid. Some of the good stuff that happened during the pandemic was, I think we transitioned a lot of things to telehealth, which was great for survivors, less effective for abusive partners, but much more effective for some survivors who have a hard time getting to us. I think all of us for years have been saying, food assistance, transportation, and childcare were the kind of the big three barriers to people seeking services. And a lot of ARPA funds took care of food assistance and transportation. We're still waiting on childcare. But, and to what Amanda said, we're terrified what's going to happen, June 2024, June 2025, when those ARPA funds do go. It's going to be a harsh reality. The other thing I think that went well is many of us transitioned our continuing education and learning to a virtual environment, which allowed us to have a greater reach. And I know a lot of our folks, our staff are getting a lot more professional development, affordable professional development opportunities that they wouldn't have had access prior to the pandemic. So there's a little bit of silver lining there.
On that, another silver lining is if you would have asked me 20 years ago if I would be working for a domestic violence agency from my living room, I would have left it. And I think when these cases are coming in that are we are hybrid, but I think when these cases are coming in substantially more dangerous, substantially more complicated, our ability to take care of our staff when the rates of burnout and the rates of vicarious trauma, it does help when somebody's trying to find a job and they're thinking like, well, do I really want to take on that 45-minute commute? Well, maybe they're going to be more available, or we can take better care of our staff as well. I mean, some services absolutely need to be in person, and some clients very much want to be in person, and we have that available. But I think if we're really getting the full picture, we also need to think about burnout and vicarious trauma to all of our service providers. The other thing that I forgot to mention is mental health. I think after all of us living through the pandemic, probably anybody could use a good therapist.
And they are in high demand and expensive. Expensive to hire.
Like, you're joking, but
No, I'm not.
that is 100%. The availability of trauma-informed and our case culturally responsive therapists who have appointment availability is far and few between. And we have a program where we will contract with therapists, but just yesterday, one of somebody that I used to be referring to on a regular basis, I could always seem to get people in, said to me, I could get this person in, but it's not going to be a couple of months. Not like I can't get them in until after the new year.
We've heard that from most local counties in this meeting.
So, I mean, I think if we're talking about COVID-based needs, that's.
While we're talking about mental health tonight, since we have somebody from the governor's office here, I just want to, something that you're already aware of, and I know that the governor's aware of too, previous administration, I served in Health and Social Services on the Appropriations Committee for 8 years. There was no strategy, there was no funding, there was no vision for the Department of Health related to mental health that entire time. And then all culminating in the very last action, one of the last actions was to sell Spring Grove, which is providing needed mental health services, not necessarily to this population, but generally to the University of Maryland, Baltimore County for $1. I'm not criticizing, I'm just saying at the moment, when you're talking about mental health in every aspect of the things that we're dealing with at a local level and a state level, there was divestment from mental health services instead of looking at a comprehensive way to address it holistically using a state option as well as providers, which is also culminated in the same situation where are there providers? Is there a state option? Is there state support? The answer is no. And honestly, that would take and I know you all are talking about it on top of it. I just wanted to bring it up since it was brought up related to mental health and state supports.
I also think that many of the survivors and the perpetrators are hiding in plain sight. Many of them have taken shelter in shelters, which traditionally do not take families with domestic violence. And so these families are smart enough to know not to say. And so now many of those families are now in our shelters. I know for a fact they're in the county, and I'm sure they're in other counties around the state. And so we're not getting them into the kind of care because they're hiding in these family shelters. So they're not getting, statistically, we do not know how many of those families there accurately are. And now those shelters are experiencing violent outbreaks that they've never experienced before. So so a lot of the issue is housing, and it is mental health services, and it is the increase, but that has been exponential, certainly in our county, and I'm sure elsewhere.
I'd like to touch on everything that you've said. So in the Child Advocacy Center, we are seeing the numbers increase. Even though we don't have the largest jurisdiction in the state of Maryland, we do the highest number of forensic interviews. We had like over 950 in the last year, forensic interviews. That's created a lot of staffing issues and burnout, COVID did, and then the increase in numbers. We've had some internal conflict at the CAC on how to handle these. The police department has started to follow the field manual. I think we didn't get to that in our board meeting, Chief, but they're sending many of those cases over to the local precinct level detectives that they're called the IST units. And those units have never worked with the CAC. They've never done a joint investigation. So we're having some transition issues around that. The therapy piece has been a huge issue, as you can imagine, for victims. And to piggyback on that, the county salaries have not been assessed and changed in many years, and they're not matching the national and even local average. And so our internal therapists leaving because they're not, they can easily go other places and make much more money, especially if they're trauma-informed therapists that LCSWCs. It's been difficult for us. The Spanish-speaking population has tripled in the kids we're seeing. So we have more time spent with translation services and forensic interviews and family meetings and all the way down through our treatment services, police department and social services, and every single piece in court. More time, money, energy. Because of the staffing issues across the board at social services, I had to let go of some of the grants that we used to have. We used to have the CJAC grant that supported the secondary traumatic stress and burnout issues related to what accreditation requires of us. And we had someone on staff, well, not on staff, but paid through this grant, who was providing 30 minutes of just checking in. And, you know, at first people are like, I don't want to do that, but it was super helpful to the staff to just check in once a month for 30 minutes with this psychologist. And we had to let that go because we don't have the support staff to help us manage these grants. And I think there's so many grants available to the CAC and all of these departments that we cannot access because we don't have the staff to support it. It's really frustrating for us. The other thing that is ancillary to the CAC, but is related, are the foster care placements. And we are seeing more hotel placements with one-to-ones on these children than we've ever seen before, which is costing the state and the county millions of dollars because we have no foster care placements. We also see a lot of kids that are stuck kids in the hospital, and those kids are unable to be discharged to a safe place because we don't have foster placements. So those are just some of the things that we've seen an increase since the pandemic.
I'm just going to echo what everybody else, as in the service providers, are speaking to. At FCC, understanding that we have rapidly housing dollars spent, but we can't spend them just because of how high prices are to get these survivors housed. But then also understanding that during the pandemic, and I'm not going to say that nobody cares, but the person that causes harm, the identified perpetrator, understanding the needs that they had during the pandemic and just before then, but they became heightened. And understanding, to Lisa's point, that understanding when there are, in these times of desperation, they're going to have higher rates of fatality just because of the desperation that they have. So at FCC, we started taking like notice of those things, and trying to offset or balance them a little bit. Just having some of the funding that we had coming from the governor's office. So just highlighting that the needs of the person that causes harm also plays a role in like the services that are provided.
So I just wanted to highlight a couple of things that have resonated throughout the meeting, and just discussing the intersectionality of the pandemic, mental health, limited English proficiency, and immigration status, and how that combination ends up blocking a lot of people from accessing services because of limitations to funding for folks that are undocumented, the reality that we've got kids that are, being removed from homes, that are getting put into foster care, but then are stuck in hospitals or hotels because foster care agencies refuse to use language access services, which they're supposed to. So they're keeping them in hospitals or in places where they shouldn't be housed. So just highlighting that, the need to also recognize the cultural barriers and challenges that families with limited English proficiency and mixed status households face when talking about domestic violence, because it's culturally not something that's done, but also how they address it and how they interact with the police or any other state or federal agency, the fear that comes from having to do any of those things, and the hesitation to do that. We have a very diverse county. It's over 110,000 foreign-born residents that live in the county. More than 60% of those are Asian. It's not primarily Latino. So the fact that we hear more often than not, about Latino victims of domestic violence, and we don't hear about these other marginalized groups, is actually really alarming to me, because that means that we are not doing the cultural competence to work with diverse communities. We also don't have language access to provide services. We also don't have the understanding of the different immigration reliefs that could come from being a survivor of domestic violence, and how we work that immigration benefit, and that there's not enough organizations or nonprofits in the county that serve those communities. So thinking about grant funding specifically for domestic violence victims with limited English proficiency or foreign-born residents, because we know how housing is challenging for Native born folks, for undocumented folks or families that live in mixed status, housing becomes 10 times more challenging.
We can speak a little bit to your points, and a little bit of that overlap with some of the police data, and domestic. Some of the data I gave you shows pretty flat over the last 2 years. Sexual assault in the SDU, there was an immediate drop off, but almost an immediate springboard back to normal case volume, and I think we can get caught up in sometimes the coding and the outcomes and the titling and the reporting. I think the more anecdotal number is the case volume that SDU is getting and handling. And I think that's deceiving, and some of it's, to your point, is the fear of engaging with law enforcement. And so I think that we don't want to engage in necessarily specific numbers, because I think it can be either manipulated or be deceiving from that standpoint. But you mentioned the Asian community, and I think that's good. On the list of folks that I felt might need to be included are NAACP and Amigos, Baltimore County.
Amigos of Baltimore County is a Facebook page. It's not an actual number.
And that's what I wanted to ask you are there other resources that you think, even separate from this group, the police department can be looking to for that 110,000 population? The Asian community is one that the city gets any access to, other than maybe through some faith-based institutions.
Yeah, we can definitely connect offline and talk about it, but I can definitely pay some different service organizations that are doing excellent work in the community.
Any other comments? I know we've sort of gone beyond the scope of the question, which is great because that's part of the intent of this working group is to have a conversation while we're all in the room together. But I do want to highlight a couple of things as we look forward to the next meetings. Just logistically, I know we've got this room until 1, so we do have some more time, but I know some people have had to step out due to scheduling conflicts. So as far as scheduling, we're going to handle it the same way as again the first meeting. I'll send out a forum for people to put their availability in based on this room's availability, which always changes day to day, week to week. Sometimes there's plenty of time here, sometimes there's not. And again, looking at sometime in early to mid-February is the next meeting. That will give time for not only digesting what we've discussed today and circulation of the notes, but also scheduling and bringing in speakers. And it does sound like one thing that is absolutely worth highlighting is the conversation surrounding housing and Baltimore County, the role that the county plays there. We have Terry Hickey, who I want to make sure I get his title correct. He is the director of the Department of Housing and Community Development. And again, looking at his team, seeing if they may be able to come in, because it does seem like from what everyone is saying that the housing issue is a significant one, and one that is an important, maybe not obvious to on first glance if you're looking at the issue, but is obviously very clearly a major factor. So I can't, again, I will work to see who from the housing side can be here to discuss that, and at the very least listen and hear your perspectives of the people in this room, just to make sure that they're aware of how much of an impact that has, and also to expand the conversation, like I mentioned earlier, on the education side, so that the colleges, universities, and the public school system are part of this conversation as well, so that they can share with everyone in this room challenges they have, which are interrelated, but have their own unique elements to them, particularly with on-campus housing. Just very briefly, and then of course, well, we'll be discussing things like human trafficking and how that is looking in the county, how it's changed, how it's making, and then also the conversation, as Juliana alluded to, of people who don't speak English as the first language or are migrants, this large number of people in Baltimore County, making sure that we bring in their perspectives, because while they're, again, very, very closely related to the general population, there's also some distinctions and different unique cultural competencies and other issues that come into play. And another topic I absolutely want to hit on is a discussion of looking at, again, grant funding and how and where these funds are coming from and what can be potentially looked at in those areas. Those are just the next couple of, again, looking out ahead, and there'll be more information as to specific agendas and speakers in advance. But I wanted to lay that out now before we get too close to that 1 o'clock mark, just so that we can all be on the same page. But again, I want to reiterate that one of the major goals of this working group is the conversation that we've been having. And I think that opportunity to have everybody in the room together and sharing what your organization or your department or agency may be experiencing, and having the opportunity to have those conversations. I do believe that in order to get to the point making concrete policy recommendations, we need to have that dialogue first to simply identify what the challenges are. We can't put the cart before the horse there. So I appreciate everybody's willingness, first and foremost, to have those conversations and to have it today, because I know personally it's been I've learned a tremendous amount, and I know that I'm not working in this field every single day, but I am sure that everyone in this room has gained additional information by having this. So I want to, again, thank everyone for attending today and for coming out. But I'm happy to answer, or if anyone has any questions or comments, still a little bit of time left. I want to make sure that everyone has a chance to. Yes, Senator.
Just one thing to kind of highlight for people is that the governor is planning to introduce an interesting and robust housing package. So I think it will be good for this group to.
Yep. Thank you, Senator.
I think also in looking at this room, which is immensely impressive, and I'm forever grateful. I think that one group that might be missing is more faith-based voices. I really appreciate what Carmen does. And I think that there are more of the women and children who end up either survivors seeking assistance or victims themselves. And I'm wondering if maybe any of you might know of some faith-based organizations doing this work but aren't a part of our circle right now, that maybe we could reach out to, either as speakers or participants.
Sure. And that's also, Amy, thank you, because if there is any organization or even any individual who's doing work in this space, anybody in this room here believes we should incorporate in, please let me know and we can shoot me an email. Everyone has my email address and we can try to bring them in as a speaker or presenter. Again, like I said at the very beginning, the quote unquote roster of this working group is not the only people whose voices are important in this area. So we want to make sure that we incorporate them and at the very least give them an opportunity to discuss the work they're doing and any suggestions they may have as well. And if anybody here, I know as we get further into the year, speaking, I know for our members of the Maryland General Assembly, I know we're going to be going into you're all going to be going down to Annapolis in session soon. If you are unable to attend, have anybody who you would like to come in your stead, or if there's any sort of conflict, just let me know and we'll make sure they get the agenda and all the information. Because I want to make sure that if there's a scheduling issue, this goes for every organization. I want to make sure that you can have somebody in the room who can at the very least report back for that information. So any other comments or questions before we wrap up?
Thank you. We have a strong connection to faith-based institutions across the county. And
sure.
The chief recommendation, we'll never use the community resources to reach out to find out if anybody's already engaged in this.
Perfect.
The second piece, just recently brought to the police department about the Center for Mental Health Rehabilitation. The police department's going to try to put together a contingent to go for that. And so if there's anybody here who's particularly interested in maybe joining along in the tour, or is more familiar with program, and be ready afterwards.
Excellent.
First on my list of doing with Mr. Collins won't do it. That's how I will fit
To the center? Yeah.
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 The Commission for Women also was organizing trips to the Montgomery County Family Justice Center, the Prince George's Family Justice Center, and Center for Hope. So I know that those tours have taken place and I think were extremely effective.
I'm willing to take another tour to the PG County Family Justice Center. If anybody wants to go, I can contact their director and set up some dates. Just let me know. They have a phenomenal program.
I do, or both. I mean,
I like both, but
yeah, I went to Montgomery County too. They're very different models, and it would be definitely something for us to consider.
Great.
Another thing, you were talking about faith-based. I ran into, you would remember Steve Rocher from the state's attorney's office the other day. And he is now, is it a deacon in a local church, and we exchanged numbers. When he was in the state's attorney's office, his focus was domestic violence. So both as a faith-based community and that he may be a good option to include. And I can give you his contact.
Please do. That'd be great. That'd be great.
And Henry, one of the last things I'd like to throw out there too, and since we live in the information age, I think at some point along the way, I think we also need to examine the role of technology and social media as insurance to this topic also. I think it's something that we saw during COVID that kind of existed, because that's where we detected things when we couldn't detect it in other ways. So we really need to look at that. And the other thing that's going to be interesting is to look at the demographic data in terms of age and demographic information in terms of victims, also offenders. I think one of the things that we're noticing during COVID, coming out of COVID, is that empirically what I was seeing is that the victims were trending towards being much younger, even trending into our teen population.
We're seeing the same. We're
So
seeing the same.
I was just wondering, I mean, that's something I saw empirically. I don't know if it's
We think
fact.
it is a good thing. We think it's the awareness, right? We were saying like, it feels like survivors are quicker to say what's happening to me is intimate partner violence and I deserve help, which is a great thing, but it does feel like the numbers, they're trending younger.
Yeah.
So our youth with sexual behaviors, that they're getting younger and younger, may be attributed to during the pandemic, having so much screen time, being exposed to pornography. Yeah, and we're seeing the severity of the child abuse offenses between siblings is much worse. It's been around a long time, and it's shocking sometimes to see what kids are looking at, watching. Our Internet Crimes Against Children unit has seen an increase in search warrants on younger kids. They're going in the home and it's like
Suspects.
Suspects, yes.
Reading all those
Exactly.
reports, the suspects were young.
Yes.
Trending younger towards those types of things.
Yeah.
Too, so.
And I've heard that unit say, what's it gonna be like in 10 years? What are they gonna be looking at then and acting out? It's just getting worse.
It's interesting because I'm sure many of us have followed the media over this week. A lot of recommendations in the media that our young people have less screen time. They're really seeing less screen time, less time on, social media, on their phones, on their tablets, and their computers, simply because of that.
But education and recent screen time, because everything's on.
Right.
And that's the dilemma.
I also saw an increase after, maybe during the second year of COVID, an increase in older adults coming in reporting strangulation. And these are like 50s, 60s, and you really didn't see much of that before. So I did see that. I don't know if that's continuing. Have you seen?
I'm not sure without
Okay.
looking at my numbers.
At the moment,
I have a lot, not a lot.
It kind of mirrors what we see in terms of see people engage in behavior when they're younger. They kind of go away from it at some point in their lives. And I mirror it to what we were seeing with drugs and overdoses and those things too. So you see people engage in this behavior when they're young. They kind of go away from it in their mid years of their life, and they venture back towards those things. So, it'd be interesting to see these offenders late in life, where the offenders when they were young. Because we clearly, the overdose thing, we're seeing, where these people were drug addicts when they were young. They kind of had their lives together in the mid years of their lives, and now they're getting into their later years, and they're actually venturing back. People who in the early 90s were crackheads. They're now overdosing on crack in their 60s and 70s.
I wonder if it's related to trauma and being re-triggered in some way.
It's really interesting. I look at it and I'm seeing people. I'm like, okay, and look at it. This when they're young, but there's nothing in this window for them. They're now ending their lives. We're venturing back to these behaviors.
I think that given that the legislature is coming up in January, and as a lobbyist, I'm sure many of us will all be down there as collaborators and coalition members and so on, but I just look around this room and I'm sure Senator can speak to this. It's quite sad. If I was sitting in a hearing right now and all of us came collectively, right, with our individual pieces and our collective challenges, I think that's extremely powerful. So I know that the MLAW has put out their initiatives, one of which is on telephone pornography and many of the other issues that we've touched upon here. There are really good pieces of legislation that are being put together now, and hopefully with the governor's package, I'm anxious to see that. It'll address some of the funding issues that we could use. Maybe policy issues. Start with the policy. How about that? But anyway, maybe collectively, that could also be a part of this.
Conversation.
Yeah.
Is there any room for bringing academia in
Oh.
and
just thinking of all the different areas that we're touching. There's research out there now about strangulation being a strong indicator to the violent crime, non-domestic related violent crime, even assaults on police. And then at a recent conference, SAKI, which is a sexual assault kit initiative, a nationwide research, all of that data put together, the number of CODIS hits from sexual assault kits tested to other sexual assault offenders versus the number of those CODIS hits to other violent crimes, it's 4 times as many hit to other violent crimes than hit to prior sexual assaults. And the point being that the work in this space, I think, has much broader implications on public safety than simply the victim and survivor groups that we're all desperately focused on.
That's right.
But I don't think in this space, while we're all working in our areas, I don't think that we're going to be able to capture it the way that maybe a researcher might be able to come in.
To piggyback on that, I'm also part of the Active Assailant Interdisciplinary Work Group with MEMA, and actually another MDEM now. But there's a huge correlation to domestic violence offenders and mass violence. So like you said, there's a bigger public safety picture with addressing these individuals.
Yeah, we're seeing 68% of any murder that had 4 or more individuals is considered a mass murder, and 68% of them have histories of intimate partner violence. I was just going to say, it's been a significant shift, I think, in our work with offenders that we've seen. When I first started in the field, it was very much believed that they're targeting the victim and the rest of the community isn't quite as much in danger, and that's just not the case anymore. We started to see kind of the increase of not just of harming the victim, but then harming the victim, the children. Then it became the victim, the children, and then self, and now it's victim, children, community, and self. And that just seems to continue to be expanding over the years. The research is really fascinating.
I think digesting that is going to be really important, and I think our delegates can attest to, like, as we go and try to advocate for resources and find where resources are going to be coming from. I think that's really important to be able to articulate the space that we're already in.
I think that was one of the, at least, hopes of the Commission for Women when we initially had the conversation, was that we all have resources, never enough, but collectively, maybe. So I think one of the things is looking at where we get our funding and how we can share some of those resources. That's what a Family Justice Center does. I think there are issues in our county because it is so large and so extremely diverse, and transportation and other siloing issues have made it very difficult. But I think that there's also a way to possibly pool our resources together, and there's larger pots of money and people serve.
Should we have a DJS representative?
We'll get someone that can look into that as well.
Maybe foster care.
When you find a DJS representative, could you send me the name? Because I mean,
I know that the
Christine Task Force too.
I have the Victim Services Coordinator contact at DJS if you want me to connect you with her.
Is it Jessica?
Yeah.
Jessica.
I was like, well, I would ask her.
Yeah. That's somebody.
All right, so on that note, and acknowledging that a lot of folks have been heading out, we're going to call it a day. Thank you again for coming out today to be a part of this and for all your work going forward. We'll be getting out meeting notes, the recording, and the Google form for scheduling the next meeting. Will be going out in the next week or so with the holidays, given it might be a little bit of a delay. But again, thank you so much for coming out here, and really excited for what we can do going forward.
Thank you so much.